All right, team, listen up. The patient is presenting with simple clinical colitis activity index, oophoreitis, and tertiary peritonitis. What's your diagnosis?
Those symptoms point towards a possible case of inflammatory bowel disease. It could also be related to reproductive organ inflammation.
I'm leaning towards a severe abdominal infection. The symptoms suggest complications from a previous surgery.
I think it might be a rare genetic disorder affecting the gastrointestinal system. We should consider conducting more tests to be sure.
No. It's boomerang dysplasia, you idiots. The only way to save this patient is by performing a fascectomy. It's risky, but it's our only shot at curing them.
Are you sure, Hawks? That procedure is extremely dangerous.
I don't know if we should go that route. It could end up worsening the patient's condition.
I'm not comfortable with this, Hawks. Is there no other alternative treatment we can explore?
Damn it. We don't have time to debate. This is the only way to save the patient's life. You wanted to see me, Tracy?
Yes, Hawks. I heard you want to perform a fascectomy on your patient. Where did you get this idea?
Well, I learned about it from some unconventional sources.
Unconventional sources. Please explain.
I came across some compelling information about boomerang dysplasia and the fascectomy procedure in the bathroom stalls.
Bathroom stalls. You can't be serious, Hawks. We can't base medical decisions on bathroom graffiti.
But Tracy, I really think this is the right course of action. The patient's condition is deteriorating rapidly.
We need to rely on evidence-based practices, not bathroom scribbles. Let's discuss this further and explore other options, Hawks.
Oh no, this is not good. The patient is in critical condition after the fascectomy. How am I going to explain this to Hawks?
Treatment for boomerang dysplasia.
You incompetent imbeciles. You nearly killed our patient with your reckless decisions during the fascectomy. How could you choose the wrong fascectomy and misdiagnose the condition?
But Dr. Hawks, we thought...
Shut up, Gary. Your thoughts are worthless if they lead to incompetence like this.
I still think we had the right diagnosis, just the wrong approach.
Wrong approach. Wrong approach. Frank, please tell me you have something more intelligent to say than these other buffoons.
Well, I think we should consider the possibility of a secondary infection causing the complications.
Secondary infection? That's the most ridiculous thing I've ever heard.
You call yourselves diagnostic doctors. You're nothing but a disgrace to the profession.
Storm's out of the room. I can't believe I haven't figured out what's wrong with this patient yet.
Maybe you should try considering some rare diseases, Hawks. Expand your horizon a bit.
I've already thought about that, Johnson. It's not as simple as just looking up symptoms and matching them.
Come on, Hawks. You're the expert here. You'll figure it out soon.
Wait a minute. I think I got it. Thanks for the suggestions, Johnson. I gotta go check on something. See you later. Hawks abruptly leaves the cafeteria without saying goodbye. I know I don't have the proper equipment, but we need to act fast. This patient's life is on the line.
Hawks, you can't just barge in here without following protocol. You're putting everyone at risk.
I agree with Gary, Hawks. We have rules and procedures for a reason. It's for the safety of both the patient and us.
What are you even trying to do, Hawks? Boomerang dysplasia was the clear diagnosis. You can't just change it on a whim.
Boomerang dysplasia was a misdiagnosis. I'm confident it's purine nucleoside phosphorylase deficiency. Trust me on this, guys. Tracy, I finally got the right diagnosis for the patient. It was exactly as I suspected.
Congratulations, Hawks. But let's not forget that the wrong diagnosis nearly cost the patient's life.
If you just listened to me from the start, this wouldn't have happened.
And if you had considered my input, we could have avoided this whole mess.
You should have trusted my expertise, Tracy.
Well, your arrogance almost cost a life today, Hawks.